Good evening. My name is Dr. Shankar. I am with Mr. Lawrence Ray. He's from Canada. We'll be talking about his experience with the Smile Center and about his experience with the dental treatment that he had undergone in our clinic. So, hello sir.
Hi, nice to be here tonight.
Right? And I would start off with asking what made you come to India and how did you hear about the Smile Center?
Well, I was in great difficulty with my teeth. I'd had dentures for almost 40 years.
40 years.
40 years. I had full upper and lower denture by the time I was 26, and I'm 66 now. So,
66, yeah.
So I was in real trouble, and I couldn't get implants in Canada. Not only did I not have the insurance that would cover it, but because of my terrible resorption in my jaws, I couldn't get the implant. And so I began to search and found a specific kind of system that I liked, and then I connected here with the Smile Center. So that was how I got here.
That's good, that's good. And then how would you evaluate the dental treatment in India with that of the dental treatments in the developed countries?
Well, I think that India's developed, so as far as dentistry is concerned, and as far as medicine is concerned, anybody who thinks that India isn't developed doesn't read the newspaper and doesn't watch television, or else they know that everything is first rate here. Every opportunity for the best care is here.
That's nice, that's nice. We have good news for the people in the ministry. Yeah. And can you distinctly identify any kind of specialty service offered by this clinic which you possibly cannot avail in your country?
I think that's why I came here specifically. I needed to have implants for jaws that didn't have crestal bone. I had no or very little crestal bone. And so I needed to have a system that anchored the implants differently. And the best system that I had seen in the research I was doing was Dr. Ida's system. And so once I found that system and read his books, then I began to look for a clinic that I could afford to come to, and also that had a good reputation.
Right, and that's how you came to Smile Center.
Yes.
Okay, and what do you think, the strength of the Smile Center? In your opinion, what are our plus points?
Well, my first connection was very important. I had tried in Europe and other clinics in India and a clinic in Turkey, and for various reasons, either the price was outlandish for me, or the interaction that I had was so sterile and clinical that there was no interaction with the dentist that would give me an idea of whether he understood my problem, because I had trigeminal neuralgia as well as this dental problem. The wonderful thing is that Dr. Prasant he's an orofacial surgeon as well as an implantologist, and he uses Dr. Ida's system. And so when I connected with him, he immediately began to respond to the questions in a way that helped me to understand, but his mannerism wasn't sterile and cold like a terrible bedside manner because he's such a warm person. So that really helped me. I knew I was coming to the right place.
Okay, and after you contacted Dr. Prashant, what actually convinced you to come down to Kerala and get your treatment done?
Well, I had to find the finance. I didn't have the finance, even though it was inexpensive, because I don't have money. And by God's grace, somebody decided that they would send me. And if you're old and poor, sometimes people take pity on you. My friend sent me, and the good thing about it was that it was reasonable for him. He could see immediately that the amount of money was reasonable. But even I could have afforded it. It would have taken all that I had, but I could have afforded it because the prices were very, very reasonable.
Okay, and excuse me, once you came down, how has your experience been?
It's been wonderful. It's like a family. The clinic is first rate. It's not like our clinics at home, where you're ushered into a private, independent space, and you have 15 minutes with the dentist, or 20 minutes with the dentist, and then you go home. This is much more family-like and collegial. The interaction with the other doctors is important, and you feel like you belong within a very short time. The staff are wonderful. So it's been a good experience.
So it's not just been restricted to the treatment part alone, but it's been more of a holiday for you, I guess.
Well, the dental part of it hasn't been a holiday, but the feeling and atmosphere of the place. I mean, Kerala is a wonderful place to have a holiday anyway, and Kochi is a beautiful place. The water's close, and I love the water, and you have all the tropical delights, palm trees and
Benefits.
beaches.
And what were the highlights of your stay here? To put it in a nutshell.
In terms of seeing Kochi and the area, I had a couple of trips that I really enjoyed. We went out to the edge of the forest, actually where they capture elephants, and we saw a zoo there and spent time visiting with several elephants for a while, and I was hugged very strongly by a very small elephant, and then a mother elephant decided she wanted to wrap her trunk around me, and I stayed well away from the father.
Okay, that sounds really nice.
But I've enjoyed the churches here. I'm a Christian pastor, and there's lots of churches here, and so I interacted with lots of different leaders in the Christian church here, and there's a lot of very historic things to see in regard to the Christian faith and the other faiths, because it's about equal numbers of Muslims and Hindus and Christians here. So,
and even Jews.
And Jews, there is a section. I didn't like the name of it. It was called Jewtown, but there definitely
It
is.
sounds more like a Chinatown.
That's right.
Okay, and so one question: has it really been worth the money?
Oh, every bit of it.
How would you value it?
Well, I've come for 3 one-month treatment sessions, and so for me, I had all the time in the world here, and so it wasn't a rushed or a hurried trip. And yet there was a young man today who had 3 implants done today, and he'll be home on Saturday, both from Canada.
That's interesting.
But so you can go either route, but if you have the time, it's a wonderful place to spend time.
And would you personally recommend Smile Center to others?
Well, I have already to a number of people.
That's good to know.
And it's particularly good for the seniors that we deal with, and many of them that have dentures and loose dentures and difficulties with pain because of dentures. This solves the problem, so I'm thankful for it. I'd recommend Smile Center to anybody.
Okay, sir. And a few more questions. I mean, how does it feel to have fixed prostheses after a very long time? You said, it's been about 40 years.
Well, the first time I had my temporary bridges in, I had to begin learning to brush my teeth in my mouth.
So
It's been a long time since I've done
So the treatment part has been like an evolution, I guess. Right from the Stone Age, wherein you started wearing your dentures, and now it's moved on to implants, the fixed ones.
It really has, and I can eat anything.
How do you feel now?
Wonderful. I just had a plate full of cashews, and I haven't been able to eat cashews for a long time. And so the comfort and the ease, not to worry about my dentures falling out. I'm a public speaker. There's nothing more haunting than the idea that your denture will come
Coming out, huh? Okay, and anything that you would like to add, anything, any shortcomings from our side, or anything that you would like us to improve?
I don't think so. I think the office is so accommodating. There's a wonderful, one of the things that was wonderful for me was that when there was a difficulty with a specific implant, it was a difficult implant, and it was one of the first teeth that I had done. Immediately Dr. Prasant called another surgeon in to attend at the same time. And several times during my visits here, that collaboration has happened whenever it was necessary. And so it made me feel very confident, and because there was a good team there.
So it was the teamwork.
It really is teamwork. It is a great team. And the lab work, the instant lab work for temporary dentures or temporary bridges is within hours they're putting in temporary bridges so that you don't have to walk around with your implants bigger. So it's wonderful.
So Mr. Ray, could you be a little more specific as to why you had to come to India for your dental treatments?
Yes, I think I mentioned that I couldn't have treatment, dental implants in Canada. It wasn't that I couldn't have. In fact, I had 2 implants placed in the front of my mouth for a lower denture, and they put an overdenture on it. But I had no bone. My resorption was so bad. It was all 4th stage resorption, and so in many places my nerve was exposed, and I would have had to have bone graft, and then 2-stage implants, and from all that I've read and from the experiences of friends that I have, that doesn't always work, and it's an expensive process, way more than I could imagine. And so I began to look to see if there was another system. And in my reading, in my research, I needed implants. I needed to have a stable bridge. And I began to read, and I discovered Dr. Edith's work, and began to read about BOI implants, and I read his book. It was actually on the internet, and I read his book from start to finish, and I was fascinated. And then I also began to understand about bicortical screws, and in the process, they wouldn't even do bicortical screws or BOI implants in North America. Although there probably are some dentists that will do that, they don't advertise, and it's not the norm.
And it's not easy to find.
No, it isn't easy to find. And already insurance companies don't like to do implant work. They call it cosmetic surgery, and so the price of implants in Canada is phenomenal, and in the United States. So I was forced because of my situation, but it was a good thing to be pushed toward, because in doing that I discovered that it was possible for even an old man with no teeth to end up with a mouthful of teeth like a young man again, and I'm very happy.
That's good to hear.
Okay.
So now I think I can say that you're not 66 years old, you're 66 years young.
There you are. Thanks. I felt that before, but now I look at it, right?
Oh yes, you do.
Thanks.
And yep, so I think we can wrap up this session. Thank you, Mr. Ray. Thank you for your time and your cooperation. And we would like to see you again in India as a tourist, not as a patient, in future.
Good. I'll come as a friend. How about that?
That's great. That's even better.
Good.
All right, folks. Thank you.
Okay.